I apologize to Dr. Carr in public for asking for extra security for that meeting. Dr. Carr, the security I requested was not about you. Dr. Presley appointed me to organize and chair the committee. The first two meetings of the committee were closed to the public. This was my decision because people had been apparently misinformed as to what was happening with the closure plans for the Lubbock Department of Health. This misinformation and possible other actions had apparently made several people in the Lubbock community angry. I opened that third meeting to the public. It was my impression from Dr. Carr that many angry people might be in attendance at this third meeting. Accordingly, I requested a security presence in the area of the meeting room because it was not known who might be in attendance at this third meeting. An armed police officer was in the room at the time. Considering the number of mass shootings and violence that we see from deranged individuals, I thought it best not to take a chance and to request a security presence in this meeting. Few people attended that third meeting. It is not known if any outbursts or acts of violence were prevented at this meeting because of the police presence. Some unknown people entered this meeting room and departed shortly thereafter, apparently departing the building. It's not known if the police presence in the room prompted them to depart the room and the building. Their intentions for entering the meeting room and for them departing were unknown. I have no intention of apologizing to you, Dr. Carr, for anything. I remain confident in what I've done in these matters. I remain confident in the opinions I've given during my 3 terms of service on this board. You and I, Dr. Carr, will continue to disagree on many issues. I ask you not to engage discussion on my political blog. If you want to send me emails, if you want to discuss things at this meeting, that is perfectly fine. I suggest you accept the fact and get used to it and accept a working relationship with me so this board can accomplish much for the business and benefit of the people of Texas. I relinquish my remaining time.
Ms. Hinges?
I think that the meetings were held at the old health department.
Which meetings?
The meetings at which we had...
Well, no, he's referenced one that was held here.
They were in this room. I chaired those meetings. I chaired those meetings. They were held in this meeting room. This was the committee for the closure of the health department.
Other comments? I would just note that one of my observations, Dr. May, did you not describe the clientele of the STD clinic as consisting of hookers?
Not that
I have it on a YouTube video if you'd like me to give you that. And is that a disservice to public health? Since it says right here in our standards that we're supposed to show respect to people, and since our goal in STD is to reduce the incidence of that disease, how do you think that impacts our ability to reach out to people when we're insinuating character flaws, sex workers? How does that help?
First of all, prostitutes are criminals.
But are the clientels at the STD clinic prostitutes?
Let's bring this into context what we talked about. I said that I was concerned with having a sexually transmitted disease clinic in proximity to a clinic, an immunization clinic that took care of pediatric children. We have state and federal laws that mandate that certain activities, such as the sale of liquor, such as adult entertainment, such as prostitution, stay a number of 100 feet away from where children congregate, whether it be school playgrounds and so forth. I also consider pediatric clinics to fall into that same area. So I raised the concern. I was informed by Bridget Falkenberry that we do not know the true identity of most of the people who come to the sexually transmitted disease clinic. As Becky confirmed, they don't have to show their IDs. They may leave contact numbers where they can be contacted, but we are not certain who they are. Simply because we're not certain, I thought it to be prudent, and I mentioned this during the initial 3 meetings that we have, that when we reset up the Department of Health, I thought it prudent to place the sexually transmitted disease clinic in an adult facility and the pediatric immunization clinic in another facility. That was my opinion. I presented it to the board. The board did not agree with me. The city council did not agree with me.
What percentage of the 2,700 people served in that clinic in 2012 were hookers?
I have no idea.
But you said since we have no idea, we shouldn't assume, but you've
What percentage
assumed.
of the people who go to a liquor store are criminals or hookers? But yet we keep that away because we don't want the people who are going there. We're not worried that kids are going to run in. If there's a liquor store next to the school, we don't prevent that liquor store from being next to the school because we're afraid that kids at recess are going to run over and steal a case of beer. We keep that liquor store because we're concerned who the clientele are going into that liquor store, and we don't want them in proximity with our children.
And I will continue, and you're right, we will continue to oppose each other because I believe that you're acting in the counter to the direct interest of public health.
That's your opinion, and I disagree with you.
Okay. Any other comments?
I am curious why these two issues that the health department moved, that all happened last year and the year before, in the past 18 months. I'm curious why these are two issues that we're concerned, particularly the security at meetings. Why is that a topic that we should spend our time on here?
I think in reference to his comments of calling me a dictator, demanding at the original subcommittee that we'd only be
I never called you a dictator, sir. I've never called you a dictator.
We're back to deductive logic. You call me a progressive liberal, a leftist, and then you proceed to say, and progressive liberals want babies to die on cold marble slabs. I think that the deductive logic is if you're going to label me one thing and then insinuate that that label then leads to another is a characterization.
I don't think I insinuated any of that to you, sir. Any discussion here has always been initiated by you, sir, on my blog, and I need to stop. You need to quit harassing me and threatening me.
Well, I would hope that in the future we could find empirical, peer-reviewed, scientific reviewed, and not get into the dogma of political ideology, which takes away from what we're trying to do. All right.
Dr. Carr.
Yes, ma'am.
I think all of us on City Council enjoy healthy discussion. I know that the Board of Health enjoys healthy discussions. However, this board sits at the City Council's pleasure, and this conflict must stop. This public conflict must stop.
Okay. Anything else? Any other business before the board? Seeing none, then I will say that our next meeting is March 22nd. And
it will be at the Civic Center.
At the Civic Center.
Yes.
We stand adjourned. Thank you.
Yes, sir. Anytime.
You remember all that stuff, didn't you?
Did you ever have a chance to apologize to your dad for my tantrum that I threw in his office?
You know, the other day he had the lady that I was dating, her daughter has a granddaughter and was sick, and Dad said, well, have them come over to the house and I'll look at it. And they had to hold her little ear, and Dad had to sprawl across her to look at her ear because she was screaming and have such a fit.
That's what I was doing.
Yeah, that's all signed.
Thank you so very much. I appreciate it.
Would you like us to paper that wording into a formal resolution that can go through the motions and get signed and then sent to the council on your item?
Oh, the one that we just passed?
Yes, sir.
Sure, that'd be good.
Might make it easier, and we'll just copy paste it.
Yeah,
You're doing great.
okay, well,
We appreciate you.
hopefully I'll still be here next month.
You will. I hope so. You're doing a great job.